Alrighty, it looks like we're about at half capacity of who has signed up. So we're going to go ahead and get started. Just wanted to start by saying good morning to everybody and welcome. We're so glad that you're here today. My name is Audrey Juhasz, and today's session is titled Designing Evaluation with Disability in Mind. Over the next hour, we'll be exploring considerations for adapting and improving the accessibility of evaluation across topic areas, and also the importance and structure of an advisory board of people with lived experience of disability. Our goal is to make this session practical and directly useful for your work. Before we dive in, just a couple of quick housekeeping notes. This session is being recorded and we'll send out the replay afterwards. Please feel free to use the chat or Q&A box at any time, but we'll hold answering questions until the end of all of the presenters. If you experience any technical issues, try refreshing your browser or letting us know in the chat. To begin, we'll do some brief introductions of our presenters today. I am a researcher at the Institute for Disability Research Policy and Practice at Utah State University. I'm a member of our evaluation team, and I specialize in quantitative methodology and analysis.
And my name is Rachel Byers, and I'm a project coordinator at the Institute for Disability Research Policy and Practice, and I emphasize in healthcare access and health outcomes for people with disabilities.
Hello, I am Kelie Hess. I'm also with Utah State University's Institute for Disability Research Policy and Practice. I'm a program coordinator there, and one of the projects I get to help with is overseeing the Partners in Disability Research Advisory Board.
I'm Matthew Huskinson, and I work for was known as the Aspire team at the UVU Pediatric Administration, and I'm on a number of boards.
Excellent. So our presentation today is broken into two parts. First, we'll be reviewing practical considerations for improving evaluation accessibility. And the second part will review the development and use of an advisory board. So to get us started, we wanted to talk about why accessibility in evaluation matters. And really what this comes down to, for me at least, is that we need to recognize as researchers that all populations have people with disabilities in them. So from this perspective, no matter what topic area you're evaluating or researching, we need to make considerations for people with different use needs. From a universal design perspective, this means that our evaluation approach will be more accessible to all of our participants. That this isn't just about making this useful for a particular group, but it actually will improve accessibility for people who don't identify as having a disability as well, which I think is a really good thing to recognize as a researcher or an evaluator. Also, it's really important to us here at the IDRPP to consider how this addresses disparities, that being able to empower people with disabilities to contribute in meaningful insights about their perspectives of the world or their experience is really important in being able to design programs that are useful for everyone within our communities.
All right, and while today we'll be talking about how you can apply these principles generally, no matter what topic you're exploring, we will start with a case study, a project that we worked on here at the Institute for Disability Research Policy and Practice. And we'll begin by talking about our recruitment and how we made some changes to make it more accessible and to implement universal design components. What we were looking at here was a SNAP-Ed, or Supplemental Nutrition Assistance Program Education Evaluation, and we were working with adults with intellectual and developmental disabilities. The SNAP-Ed curriculum we were working with was called Create Better Health. That is Utah's SNAP-Ed curriculum. They have a lot of incredible resources online. They deliver in-person and virtual training, and we wanted to make sure that what we were doing was inclusive of all of their participants. And they had reached out to us and asked for some assistance in making sure their evaluation specifically was accessible. So we started out with their existing surveys, and we modified those based on our own knowledge and expertise And we also wanted to make sure that they were accessible for the people who use them. And we wanted to make sure that we involved the voices of people with lived experience. And we'll talk about that a little bit later. We also employed some biomedical measures. One was a hand keratin scan, and we used interviews with a couple of different groups, one being the individuals themselves with intellectual and developmental disabilities, their support personnel, whether those were paid caregivers or unpaid caregivers. We also interviewed instructors who delivered the Create Better Health curriculum in its adapted format. While we were recruiting, we wanted to make sure that any materials that we had were accessible to the population we wanted to involve. So first and foremost, we used plain language. This is a principle that is used broadly, and even still, after years of doing this, I need to make sure that I implement and I have specific tools that I like to use. So we began with making sure that our materials used plain language, whether that was our flyer or instructions for participating. And we made sure that images, or again, our flyer had the correct amount of contrast. Oftentimes, if there's too low of a contrast, that's difficult to read, especially for individuals with vision impairments. We also made sure that our digital materials were accessible to screen readers. So making sure that individuals who use screen reader technologies could access our materials in a way that made sense. We also made sure that any website elements were accessible, and we are fortunate to have a resource at the Institute for Disability Research, Policy, and Practice called WebAIM, and this link will be on the slides that will be sent out afterwards. But they have wonderful resources for making sure that your web-related materials are accessible. We also used some diverse recruitment methods to make sure that we were using every avenue that was available to us, knowing that not everybody uses social media, which is a common way to recruit currently. We wanted to make sure that we were in settings where people with intellectual and developmental disabilities spent time. So while we did have a digital element, we focused heavily on recruiting in person. So I spent time at different disability service providers throughout Utah, delivering flyers that were printed already so they could be handed out to program participants, and making connections at those providers, and then also providing digital versions that could be distributed virtually as needed, and making sure we had recruitment materials in every format that we could. We also would recommend using a short video or audio description. You could think of that as a radio advertisement. Being able to provide those recruitment materials in another format other than printed is a great way to reach audiences who don't use printed materials as much.
So the next key element that we wanted to cover is related to the IRB. And we here at Utah State University have a really great IRB that has a lot of rigor. And we had the opportunity throughout this project to do a little bit of training with them as well. And I wanted to just touch on a little bit about what that process looked like. So the first element of most research is related to informed consent. So people with disabilities are a protected population, and as such, there are additional considerations with working with the IRB specifically. But we need to recognize that the informed consent process includes both a document that people generally sign and a process for ensuring that participants voluntarily agree to participate after fully understanding the relevant information. And unfortunately, usually the document part of this is very technical, that it can come across as very legal, like it's a binding contract. It is, high stakes in some ways. But being able to recognize that these pieces can be made plain language and accessible is really important to us, that people understand what is going on and what they are being asked to do in this context. Next slide. So, like I said, for the document specifically, you should be looking at having it written in plain language. The reading grade level should be no higher than an eighth grade reading level, and that you should be thinking about also like accessible formats. If you're using it online, is it accessible to screen readers? Is it formatted appropriately that the screen readers will be able to, jump from heading to heading, for example? And you might consider including a video, as Rachel just explained, that it's not just about recruitment, but also the informed consent process can be adapted so that some of these elements can be presented in multiple different ways so that people on all different levels can understand what they're agreeing to be a part of. Next slide. In terms of the process, we in this study included a capacity to consent process. So the real crux of this is that we wanted to ensure that the participant felt like they had the autonomy to say yes or no to this study if they wanted to be a part of this. We structured it to be very conversational so that it wasn't just a yes/no checklist. Especially because of the history of compliance with people with disabilities, that they have historically felt that there are many areas in their lives where people just want them to comply. That they should give the expected answer and not necessarily the answer that perhaps they are feeling by their own volition, that we should avoid situations where they feel like they have to give the right answer. So instead of asking, do you understand what this research is asking you to do, yes or no, we asked, if someone asked you if you have to do this research, what would you tell them? And gave them an opportunity to have a conversation with us about what they understood from our explanation. Next slide. So another one of the process considerations that is really vital is the legally authorized representative or conservators, that many people with disabilities have LARs, and they are required to have somebody sign the informed consent on their behalf. However, this varies significantly based on the severity and the type of the disability, also on state laws. The nature of the research that's undertaken, like how much risk is inherent in it, and the law requirement may be different for legal or financial matters. So this is something that if you're considering doing research with a person or with people with disabilities, or in opening that up in your study, that you should be talking with your IRB specifically, because they'll be able to give you some of those very specific feedback about that. So one thing to consider, though, is that by excluding participants with LARs, you may exclude participants who otherwise would have the capacity to consent, that they're able to give consent and they have the autonomy and understanding of what they're being asked to do. But because they have a legally authorized representative, they may be barred from participating just because you haven't, or if you haven't taken the time to include that as part of your process. One thing that we did learn throughout this process with our IRB, sorry, was that as soon as we said, oh yeah, we want to include people who have legally authorized representatives, they said, oh great, so that person will override the signature of the individual. So you don't actually need to do capacity to consent. And that was where we got to have a great training experience with them and talk about, like, no, we want to make sure that we're jumping through the legal hoops, but also that we don't want people to participate who don't personally want to participate. They still have the autonomy themselves to say no if their legally authorized representative says yes. So as you're considering how do I engage people with legally authorized representatives, you should be planning for engagement with those people, which may mean that you'll need to do this back and forth if you can't get those two people in the same room at the same time as a part of your recruitment. But you might, send out your recruitment information, and then they need to pass it off to somebody who has the legal authority to sign it for them and then pass it back to you. That just planning for that extra step is an important part of considering how to do your research. Next slide, please. Thank you.
So let's go ahead and jump into some of the practical application with tools that we use to make sure that our evaluation components were accessible. starting out with our survey, we modified an existing survey to make sure it was accessible. And again, plain language is one of the first things that comes up when we talk about accessibility. But we took an additional step that is critical, and we reviewed the survey with an advisory board composed of people with lived experience of different types of disability. So rather than myself, relying on my own expertise and making these changes, I wanted to make sure that someone with an intellectual or developmental disability would be able to read through this survey and feel that they understood and could participate fully. So what we did was review the survey as if we were taking it as a group with individuals with lived experience of disability. And I will go through some examples of changes that we made based on their recommendations in just a moment here. We also ended up or considered simplifying scales, and this was a recommendation from a direct support professional. We were asking a question as part of the survey, and we were recommended to possibly consider reducing or simplifying response options. So, for example, having something like a binary response where you say agree or disagree, and then if it's agree, you can say strongly disagree or slightly disagree, or alternatively, strongly agree, slightly agree. And this also was recommended to us as a way for individuals who are non-speaking to participate, who can, raise their hand as a response option, something that engages beyond just verbal communication. And of course, one consideration here is a potential psychometric impact. So we do have reduced variability when we're simplifying those scales, but it is a great way to increase potential participation for individuals who are non-speaking or otherwise would be unable to participate. And another thing that we think about often with accessibility is visual considerations. And a few key elements that we included here in our survey were high contrast. So when someone is looking at our survey, on a phone or on a tablet, we often use tablets in this scenario, is the contrast high enough that individuals with visual impairments can read the text. We also took into consideration color blindness. So in any of the visual elements that we included, making sure that they were on a scale that was perceptive by anybody with color blindness, and making sure that any imagery we used was relevant and fit the scenario and didn't have any decorative imagery that was distracting or potentially confusing. A particular note here for online surveys, there are a number of platforms out there. For this specific case, we used Qualtrics, which allowed us to do some specific embedding of imagery, which we'll show briefly here. Making sure that whatever platform you do use is, again, accessible to text-to-speech readers or screen readers, so we can make sure that individuals with impaired vision can understand and participate in the survey fully. It's also possible to implement recording video or audio responses for individuals who are unable to manually type on a device. You can also make sure that individuals who are taking the survey can increase text size and button sizes. And again, contrast, making sure that the background of your survey, any images and text that you have are discernible, making sure individuals with vision impairment can easily read what's written, and making sure that question types are accessible, which we will dive into. We have a few concrete examples here of questions that we changed, or this first example is the instructions piece, a little component of that. And these are adjustments that we made based on feedback from the individuals that we worked with lived experience of disability. So you'll see before, it's a short blurb, and generally brevity is preferred, but if we need more clear instructions, we may need to add a little bit. So here, there was a brief section saying, please take a few minutes to answer the following questions. All responses are confidential, and there are no right or wrong answers to any questions in this survey. The information you provide will help us improve our program and be accountable to SNAP-Ed funders. And after talking with our advisory board and reading through the section a few times, we ended up changing the word selection slightly. So what it looked like afterwards was, please take a few minutes to answer the following question. All responses are confidential. We will not share your answers with anyone. There are no right or wrong answers, and your answers will help us improve our program and be accountable to SNAP-Ed funders. And what we ended up doing was adding this little section underneath, providing some clarification for answering and filling out the survey, which is that, especially in handwritten surveys, because that was an option here. For each of the questions, there's a circle next to each answer choice, so you can mark your choice by filling in the circle or marking it with an X. Or you can circle the words for the answer you choose. And if you aren't sure about a question, you can ask for help, because we were there to make sure people could understand and complete the survey. This is an example of the functionality of Qualtrics that we appreciated in this use. We ended up changing this question from a list of radial buttons that are close together to be expanded so that each question had its own space with radial buttons. And after having conversations with our advisory board, we decided to include a visual representation of each of these answer options. And what this shows is an approximate calendar or number of days situation that represents the word response. So we have never, which shows X's on all of these days, all the way to always, which is green check marks in all of the boxes. This is another element that we changed after having discussions with our advisory board. They recommended some visual representation of physical activity and especially inclusive physical activity for this question. So this question began as, in the past week, how many days did you exercise for at least 30 minutes? So it requires thinking back and doing a little bit of internal math. And what we ended up adjusting it to was check the box below for each day you exercised for at least 30 minutes last week, which still relies on recall. However, you can think back to what last week looked like, or you can think about what your schedule normally is and what that typically looks like, and you can mark the boxes for which you typically get exercise. And I will say, while delivering the evaluations, I could see how this changed the ability to respond or the engagement with the question. So previously, there was, you'd think for a moment and give a number or choose a number. And after we had adjusted the question, it was more of a, well, typically I do this and I feel confident in saying that on this day I get 30 minutes and on this day I get 30 minutes. And they also appreciated seeing that we are considering physical activity or exercise as something that can be done in a wheelchair or in different ways. It doesn't necessarily look like going to the gym. A few more notes on the interviews that we conducted and how we made sure those were as accessible as possible. Again, plain language, driving that home, making sure that that's one of the primary principles here. We made sure that that was also reviewed by our advisory board. So any of the interview questions that we drafted, I discussed with our advisory board. And you can include visuals as appropriate if they're relevant to your interview questions and may assist with recall. You may want to consider ability for people to participate who are non-speaking, so email or chat responses. There are also alternative communication devices that could be used. One thing that can be helpful is to send questions in advance so that people are able to prepare. And we also, in this specific situation, allowed for the presence of a family member or paid caregiver, direct support professional, or other support person. That we left up to the individual who is participating in the interview. It was their choice if they wanted to do it independently or if they would feel more confident with a support person there with them. We left that up to them. We also wanted to make sure that anything we were doing that required interaction with a device was understandable and accessible. So for this case study specifically, we did use a skin carotenoid scanner. And this here, you'll see a picture on the screen of what that is. And it kind of feels like you're holding a cell phone is the way that I would describe it. It's like a cool plastic metal feeling. So we wanted to make sure that people with disabilities felt comfortable interacting with any equipment that we had, especially because in previous scenarios, maybe in doctor's offices, they may have had negative experiences with equipment. So we, in addition to our typical recruitment flyer, we created a flyer with information about the scanner that explained what it was, why we're using it, why it's helpful, and also what it might feel like to interact with it. And we also made sure that people could interact with it at their own pace. So when I was doing this in-person collection, one thing that I would do is show it at the beginning of the scheduled time and say, this is our skin carotenoid scanner. I had previously passed out the flyer. I would say this is an option. You don't have to interact with this, which is another piece of informed consent, is at the beginning, making sure that they understand that they do not have to participate in all elements if they choose not to. But providing any additional information that would help them feel more comfortable participating and giving them the opportunity to think about whether or not they want to participate in this section. And I did have a few people who would come and look at it and then think about it and then come back later and say that they would like to do that part of the study. So giving some extra time and taking the time to explain what interacting with that biomedical piece would feel like, look like, can be very helpful for accessibility. Another important note to keep in mind when we're working with individuals with disabilities, especially individuals with intellectual and developmental disabilities, is making sure that we are empowering their perspective, their experience, and their voice when they are answering evaluation questions or participating in any form of assessment. We may need to individualize our communication approaches. We may have individuals who are non-speaking, so keeping that in mind always. And one thing that stood out to us during this case study specifically is ensuring that we remain neutral and respectful when we are data collectors and also providing that training for other data collectors who are part of our team. So when we are soliciting information, collecting answers for an evaluation, it is not our role as a data collector to assess whether an individual is answering objectively or truthfully. One thing to think about here is, would you doubt recording an answer if you were unaware that the person answering had a disability? It's one way to remember our bias that we may have and keep that in check. So one example is there potentially, if you have a question about someone participating in an advanced degree program or an advanced education program, and the individual answering has an intellectual and developmental disability, responds yes, that they do participate, you may be able to provide some clarifying information about the question to ensure understanding, but it is not our job as a data collector to make the decision as to whether or not that is true. We are asking them about their experiences, their perspectives. So and a note there, if objective information is critical, you could consider reducing reliance on self-report or recall, as in any study with any population. We made sure that anyone participating in this case could include family members or caregivers, or maybe paid support professionals that help them feel more comfortable and confident in participating. One thing that we can do as data collectors and when we are shaping and designing our studies is to provide some proactive guidance to family and direct support professionals. There are times when a very well-meaning family member or direct support professional may try to answer on behalf of an individual with an intellectual or developmental disability. But we would like to encourage family members and support professionals not to answer for or influence the individual's responses, because especially if they're designed to elicit the participant's experience. There are, of course, scenarios where an individual might ask for help describing or remembering, and when it is their choice and they initiate that, of course, we welcome that, but we want to make sure they are driving the conversation or the experience and making sure that they feel empowered to answer the questions. You may want to discuss items. Family members, support professionals might have questions or concerns. And again, we can reassure them that there are no right or wrong answers when we are looking to capture the participant's experience.
Excellent. And just to wrap up, we wanted to talk about how accessibility is not a one size fit all. But I hope that you recognized, as you know, Rachel has been talking about all these different ways that we could make these adjustments and these opportunities that we had to think about how can we make this accessible for somebody who has this type of ability. That it is really an ongoing process for any project to really think about like being intentional in including people with disabilities of with multiple abilities in your evaluation. So training and collaboration are key. Being able to collaborate with those people who are participating and their family members or support personnel. Also, taking the time to provide this type of training for your data collectors and other people on your team is really essential, because really that approach and like mindset when you're going to collect the data makes a really big difference in the data that is collected. Another like bigger picture thing is just that we need funding to support inclusion. That a lot of this adaptation and just giving people more time to consider it takes a little bit more in terms of costs. And so being able to, you know, account for that back and forth step with, you know, a legally authorized representative just takes a little bit more time. And those little bits do add up. So advocating for additional funding or setting aside the appropriate funding in your budget to be able to address some of these additional costs is really important. But as a research community, if we're all making this case for the funding agencies that we, you know, work with, that hopefully some of those funders will get the message that this is really important and the voices that we want to hear are key. And so hopefully we can see a shift in some of that at the larger level. And then also just thinking about engaging people with disabilities early, that it takes time, just like getting familiar with any new population, that we need to invest our own personal time and effort to understand what are the needs of this community. And so engaging with those people early on and giving them ample time to give us feedback that we can still make changes before jumping into the evaluation or a research project that we have in mind really gives us the opportunity to be thoughtful about how we design things from the get-go. So with that, that gives us a lovely segue into the second portion of our presentation today, and I'll pass it over to Kelie and Matt.
Okay, thank you, Audrey and Rachel. We're gonna share about the research advisory board that was established not even quite a year ago at the Institute for Disability Research Policy and Practice. I feel like this was a really exciting move for the Institute to make. We have an established research team of professional evaluators and researchers, and we really wanted to think about how we could include the disability perspective into the research that was being done at the Institute. And so the idea came about to develop an advisory board of individuals who have lived experience to bring their experience and critical insight to the research process. And so we developed it was just a research advisory board, but that's kind of a boring and generic name. So after we found individuals that were interested in being part of this advisory board, together we came up with the name Partners in Disability Research. And it's composed of people who have lived experience and family members. And really it's just a chance again to bring in the voice and perspective of those with disabilities into projects and research that is being done connected to the disability community. We wanted to create this advisory board because we felt that historically, people with disabilities, there's been a lot of research done on behalf of people with disabilities and on people with disabilities, and research that impacts services and even just the overall lives of people with disabilities. But there has not been a strong emphasis on including people with disabilities in this research process. And so with this advisory board, we were hoping to make that shift and change and really create a space for providing feedback throughout evaluation and research to improve the relevance and the ethics within this research. So again, it was just this idea of bringing in people with lived experience to be part of it, and not just in a a token way, but really thinking and being mindful of what this could look like as far as the research process, and bringing in perspectives of people who live with disability. And it really, we wanted to be mindful and make a commitment that it was going to be actual participation, not just in word or on paper, but truly in action. So when we thought about developing this group, we recognized that there may be a need to provide some initial training for individuals that maybe have not yet had the opportunity or experience to participate in an advisory board. We recognize the value of research, but that doesn't mean we've all had experience in research or understand research process. So we wanted to provide some training for individuals that were going to be part of this advisory board, just so they had a foundational knowledge of projects and research and some of the language and vernacular that is used within the research world. We wanted to ensure that feedback was able to be given on all aspects of a research project, and including publication and dissemination of the research done and the results of that research. And we just wanted to really be mindful of like the lived experience perspective and that how that can provide insight to research, and not just on research that is about or connected to disability, but just research in general as well. So this is our Partners in Disability Research Advisory Board. We're a small group right now, and we haven't even been together it hasn't quite been a year yet. So we feel like this year is very much, we're in development, but even within this year, we've had a lot of growth and development, and we've had some really good opportunities to provide feedback to research and have impact on research being done at the Disability Institute. And with that, Matthew is going to share. Matthew is a member of our research advisory board, and he's going to share a little bit about why he wanted to join this group.
But the reason why I wanted to join the advisory board was I like to advocate for improving people life with a disability. Those with severe disabilities don't always have a chance to communicate. We can do our part to speak up on their behalf, and people with disabilities can contribute to society for the greater good. It's important to be involved. The more people you know and the opportunities you take, the more people we can help.
Awesome.
What slide is this? Is this slide 8, Kelly?
Yeah, this is the one. Yes, I think it's slide 8.
Okay. Oh, I'll just read it from there. In their own words, being part of partners in disability research gives meaning to the research around disability. It is a place where I feel like I am heard. Having a voice in research can improve the quality of life for those with disabilities. Research can empower people with disabilities and enlighten service providers about areas of discrepancy. Knowledge is powerful when it comes to assisting those with disabilities to be inclusive in their own lives and the world in which they live. Research around disability will have a real impact on the life of my child. It makes sense to have the voice of those who live with disability guiding the research done around disability.
Thank you. So these were just some perspectives from others that are part of the Partners in Disability, the Partners in Disability Research group.
Even though we are just getting started, some of the work we have given feedback on includes survey questions for a new training on disability in the United States. We have given feedback on some research papers to make sure that they were accessible and written in plain language. I'm really excited about how this group can be part of research and projects that will impact with people with disabilities moving forward.
Okay, thanks, Matthew. We really felt like we wanted to, as we were starting to develop and think about who might want to participate in this research advisory board, it was important. Well, when I was asked to oversee this group, I was very excited. But one of the things that was particularly important to me is I wanted to find individuals that had a sincere and genuine interest in participating and wanted to bring their perspective and voice to give feedback on disability focused research. I'm a person with a disability, and I've had multiple experiences where I've been invited to serve on advisory boards or work groups or different committees, and I didn't know if I was being asked to fill a diversity need or bring a disability perspective, or if it was because of the actual experience, knowledge, and contributions that I had to bring to that group. So I really wanted to be mindful about finding an authentic fit and not just filling the seat because a person happens to have a disability. But I wanted to find people that cared about research and viewed research and giving feedback to disability research as a way to advocate for others with disabilities. So our vision for engagement is to really inform and guide research at every level, including ideas that are just in development, and as proposals are being put together, kind of including the expertise and knowledge from this advisory board for considerations of new research projects. We wanted that perspective to be included in study design and methodology, as well as recruitment and the consent process, data collection and interpretation of that data, and then the dissemination of findings in an accessible format. I feel like, again, was an important concept that I really wanted to have as a focus. I feel like there's been a lot of research done around disability, but how is that research, or the findings from that research, how is that being shared? And is it going back to the disability community, including those with lived experience? And is it done in a way that is accessible to individuals with disabilities? So this is a big part of why I think there's a lot of value in having an advisory board comprised of individuals with lived experience, so they can give real feedback and input on how research findings can be disseminated in a way that makes sense and is going to be meaningful to individuals with disabilities. I think all of these considerations ensures that research is meaningful, inclusive, and beneficial to people with disabilities in the broader community. So again, just thinking about blending researchers and professionals with the disability community and not keeping them so separate, as I feel like that's kind of how it's been in the past. And I'm excited for the shift that is happening. So why does it matter to include lived experience within research? This is just a question that I think is worth all of us considering. Disability is not a niche issue. It intersects with every population. People with disabilities exist across all racial, ethnic, gender, socioeconomic, and geographic groups. And because of that, all research and evaluation should be designed with disability in mind. If disability is not currently impacting you personally, that does not mean that is not a huge demographic within our population and should be taken into consideration. So thinking about using universal design principles to make participation accessible, Audrey and Rachel shared some excellent ideas and strategies on how to do that, and how they did do that within their research, including disability status in demographic data collection, ensuring materials are readable, navigatable, and usable by people with all abilities, and engaging in advisory boards really validates the relevance and accessibility within research. And so I encourage anyone who is doing research to find ways to bring in the lived experience perspective of people with disabilities. And also making inclusive research as a standard. It's not just ethical, it really does improve the quality. Audrey and Rachel touched on this by making research methods more accessible to people with disabilities, it doesn't just benefit people with disabilities. It doesn't just benefit a select group. It is an improvement and a benefit for everyone. It produces more accurate and representative findings, and it promotes greater trust and engagement from participants, as well as bringing enhanced relevance and usability of results. So just some other implications for practice and policy to consider. Just prioritize accessibility in your practice, and practitioners should focus on universal design to ensure that evaluations are inclusive and that data is representative and accurate. Being mindful of training on disability awareness, especially if you are doing research that is connected to the disability community. I feel like this is important to have a good foundational knowledge and some added training on for evaluators training, so that they can have information on disability awareness, ethical engagement, and effective communication strategies. And then thinking of supportive funding mechanisms, policy should provide funding for adaptations, compensations, and extended timelines to support inclusive evaluation. So as you're writing your proposals, it's a really good practice to think about tagging some funding around adaptations or compensations for individuals that will be part of your research. And then sustain inclusive programs and looking at alternative funding sources as essential to maintain inclusive nutrition, education, health, and equity programs. So we wanted to leave some time for you to consider some questions and some self-reflection. So you're welcome to put in the chat your thoughts, but we really just hope that you will take a minute to think about the work that you're doing and consider how you can adapt your evaluations and what may be some barriers that you're currently facing, and how are you going to navigate through those barriers to ensure that your evaluations are more inclusive of people with disabilities.
Fantastic. Thank you so much, everybody. And we've had some great questions coming in. Thank you so much for everybody's who has submitted questions. Rachel and I have typed back responses for quite a few of ours. So Kelie, are you okay if I throw you a few that are directly for you?
Sure, yeah.
Awesome. Okay, the first question is the Research Advisory Board different from the Consumer Advisory Committee of the USAID/LEND?
Yes, this is a different group that was just developed. It's been it'll be a year in April, and yeah, this group really is just focused on providing perspective, feedback, and their perspectives on research that is done by the research team at the Disability Institute. However, we are looking to expand. We feel like we're getting close to a place where this advisory board is, getting our feet under us, and we're getting kind of familiar with the right framework for how to provide feedback to research. And so we're looking at opening up our expertise and our knowledge to research being done even beyond the Institute for Disability Research Policy Practice. And I will also add, because I forgot to earlier, but because we consider people with disabilities, we consider their lived experience to be expertise. And when they bring their expertise and give feedback and input to this work, we think it's very important that they are compensated for their expertise. So there is funding set aside to compensate the individuals in this advisory board for their time and the contributions that they're bringing to this important work.
Excellent. That was actually one of the next questions was about compensation. The person who asked that, if you have any additional questions, go ahead and pop them in the Q&A and we can follow up on that. But somebody also asked, they wanted a little bit more details about the actual process of identifying your members. Did you find them through a survey, a poster, a word of mouth? Like, how did you do that? Would you like to talk about that, Kelie?
Yeah, that's a great question. So it really was just kind of tapping into our partners and our the network that the Institute has. We do have a lot of partners in the disability community, but we developed a flyer, but with that flyer that kind of just gave some basic information, we asked people to submit some information about themselves and why they have an interest in participating, particularly in this advisory board that like that has input on research. And most of the time, so I think I met with every person, just kind of very informal, casual conversation over Zoom or on the phone. But they would submit some information about why they had an interest and if they had any experience, although that was not required, experience serving on other advisory boards. That wasn't a requirement, but we just kind of asked that more out of interest and to know if we could supply some additional training and support for serving on this advisory board. And we do, I will also add, we did build in like just support as needed. I'm here to always meet one-on-one with individuals. So if we're as a group brought questions or summaries or project proposals that the research team is wanting feedback, if an individual would like one-on-one support for not for gathering their thoughts or communicating their thoughts, that support is always available to them.
Excellent. Thank you so much, Kelie. And I see that we are just about at time, but I do want to address this one last question that I think is really thoughtful. So it says, how did you help Lars understand the reason and important for people with disabilities being involved in the consent process? In my experience, some Lars have expressed frustration about wanting to sign up for a study and sign for the person with the disability, reporting that it would cause too much stress and that requiring the person with a disability to provide informed consent/assent felt exclusionary in nature. And I think that this is a really good place for us to wrap up, because I think that this is an ongoing problem that, Kelie and I are a part of this budding study with the vocational rehabilitation, and we had initially proposed it as a randomized controlled trial, and we're recognizing why nobody does randomized controlled trials with the VR program, that there is just a lot of strongly held beliefs and a lot of layers to work through when considering people with disabilities. And I think that recognizing that these people have an important voice, that it does maybe take a little bit more time to connect with them, but it's valuable. It's time well spent. That not everybody wants to participate in a research study, and that's okay. but making the time and effort to recognize that they should be at least invited and included, that there's opportunities here to do some education, that it's not easy, but it's something that is valuable and improves the quality of our work and the usability and representativeness of the results that we get in the end. And I hope that I know that doesn't quite answer the question about like how do you get Lars on board, but I think that as we all do a little bit to change the way that we're thinking and approaching these things, that those little changes will build up and we will make progress as a group, as evaluators, as researchers, that making that a consideration and something that we're all being a part of, that every little bit will help. Did anybody else want to add to that before we wrap up here today? Excellent. Okay, well, as I mentioned, we will be sending out this recording and the slides later this week. Thank you so much for everybody for your time and attention here today and for all of the wonderful questions.